Come on now. What is this? Come on. What the fuck? Okay, stop. What are you doing? Come on.
The red egg?
Yeah, yeah. So I will just stand there. Come on, go first. After they live, I would say after they get the yeah. Oh, come on.
Is that okay?
Welcome, and please be seated. Welcome to the May 2022 School of Nursing graduation. We are so pleased to welcome our most important guests, the graduates, and their friends and family members who are joining us in person at the Bass Concert Hall on the UT Austin campus tonight, as well as those of you across the nation and the world who are watching the live stream video. The faculty and other administrators of the University of Texas at Austin School of Nursing are proud today to recognize 147 very special graduates. In this ceremony, we will be just recognizing the students who are completing graduate degrees, and we are proud to recognize 9 students who will receive the research-focused Doctor of Philosophy or PhD degree, and 21 students who will receive the highest degree in clinical practice, the Doctor of Nursing Practice. 48 students will receive the Master's of Science in Nursing degree, and we have 12 students tonight who will receive their postmaster's certificate, including our first graduates from the Acute Care Pediatric Nurse Practitioner program. As part of our ceremony, I would like to recognize the faculty and staff of the School of Nursing who've supported our students during this very challenging time on this educational journey, as well as their many clinical and community partners who've provided the essential experiential learning. Our faculty includes experienced, renowned teachers, clinicians, and researchers who strongly believe that the nursing profession is vital to the public good. Throughout their teaching at all levels of our curriculum, the faculty are committed to preparing students to address the many significant healthcare challenges of the 21st century. Faculty, please stand. Thank you. Please be seated. I would like to give special recognition tonight to 2 faculty who are retiring after many years of service to the school and the profession of nursing. Dr. Gail Acton, our Assistant Dean for Graduate Programs, and Dr. Sherry Inararity, the Marshall. Thank you. to both of them for their leadership and dedication to the educational programs and students at the School of Nursing. I am confident that most of you here tonight have heard it said, "What starts here changes the world." Well, I would venture to add that what starts here in this School of Nursing heals the world. And that isn't because we prepare our students with all of the specific technical and clinical skills and knowledge that they will need in the professional practice of nursing, although we most certainly do. It isn't because we provide them the necessary foundation upon which they can build successful and rewarding careers in clinical settings or in research or in academia, although we do that as well. We say what starts here heals the world because in the great tradition of the University of Texas at Austin, we prepare our students to be continual learners and courageous leaders whose care for individuals and families in our community combines the very best and the very latest in the art and science of nursing. The core purpose of the University of Texas at Austin is to transform students' lives for the benefit of society. And that has never been more important than in these last 26 months, when we face the massive public health crisis of the COVID-19 pandemic. Simply put, nurses have been heroes every day and in every setting. The need for and the value of nurses, especially the well-educated Longhorn nurse leaders graduating today, has never been greater. I feel incredibly privileged to be here today in person among these outstanding graduates and their friends and families who've come to celebrate and recognize their success. I can promise you that these master's and doctoral graduates all understand the urgency and necessity of striving for excellence in healthcare practice and delivery, education, and research. And the last 2 years have reminded the world of how critical nurses and nursing leadership are to not only the quality of care and well-being of our nation, but our very survival. Each one of us will someday need a nurse, and you should know that there is a strong body of evidence supporting that the education of nurses and the quality of nursing care is linked to a variety of positive health outcomes, including decreased hospital readmission rates, decreased admissions, infections, and lower mortality rates. Indeed, your very survival. Excellence in healthcare can be defined and operationalized in many ways, and I certainly expect that it means many different things to each person in this room. But I would suggest that we could all probably agree with the Robert Wood Johnson Foundation's position that excellence in healthcare, and more importantly, excellence in supporting and promoting health in our population, is about providing every person the means and opportunity to live the healthiest life they possibly can, so that the opportunity to achieve health is not a matter of chance related to your place of birth, your ethnicity, your income, or other personal factors. This broad vision for health cannot be accomplished without nurses. As I suspect many of you know, in this audience, nurses make up the largest group of healthcare professionals, more than 4.3 million in the US, and year after year, nurses are identified as the most trusted profession by the American public. As we look at the challenges facing us today, the need for healthcare redesign that focuses on value-based care and patient and provider satisfaction, it is absolutely essential that nurses are part of the team leading these efforts. Nurses as a group are strong-willed, and believe me, as a dean, I know just how strong-willed they can be. And they are passionate about their work. They care deeply about those in their care, regardless if it is in an intensive care unit or a healthcare system or even a school of nursing. Yes, change is difficult, but nurses know how to get difficult things done, because that is what nurses have done every single day of their professional life. If we are to make a difference and change the world, then it is imperative that we, and graduates, I'm looking at you when I say we, better communicate a vision and have the courage to change how healthcare is provided in a more equitable fashion, and acknowledge the incredible hard work and dedication that's necessary to seeing that vision through. My questions to all of you graduating today: are you determined to see that these changes happen? And perhaps more importantly, what role will you take in making these changes happen? At this time, we will now have congratulatory remarks from a representative of the graduating graduate students. Katie Allen, a graduating PhD nursing student, will speak on behalf of the graduate students. Katie?
Thank you, Dean. Good evening, everyone. I'm going to tell you a story about what it's like to be a graduate student in the School of Nursing. This is a story of gratitude. This is my story. In the earliest days of our programs, we all came together as strangers. We came from a variety of personal and professional backgrounds, eager to learn, eager to work. These strangers quickly became our friends. And when I look at them now, I can't even imagine not knowing their faces. The first year was quite an adjustment, transitioning from our current roles to becoming students once again. And for some like me, it had been a minute since we'd been in the classroom, but we adapted and we thrived. And it was largely because of our friends and family. We had our successes and they were our biggest favorites, celebrating our accomplishments, big and small. Those were the good days. The days when we said to ourselves, I can do this. I'm good at this. And those smiling faces were there for us. There were days, though. There were hard days. We were being challenged. Advanced practice patient care, nursing theory, academic writing. These were the days that made your brain feel like silly putty. There were days when I thought to myself, why did I choose this? Am I smart enough? Can I do this? Have you ever heard the saying, doubt kills more dreams than failure ever will? These tough days, those were the days that our friends and families held us up. They carried us. And in my case, dragged me along until I got it together. I'm grateful for the support of my friends and family. They deserve a mother, a daughter, and a partner they can be proud of. Once we hit the first summer session, we were fully immersed. Graduate school was all we talked about. It was all we thought about. That's about the time when people outside of our program stopped asking us how grad school was going, for fear we would tell them. Now, I wouldn't be a good graduate student if I didn't give you at least one statistic. 37.5%. That's how much of the US population has a college degree. For today's graduates, it's at least their second. For many, their third. And for some of us, are fourth. And some of you are already thinking about doing it again. Yeah, don't shake your heads at me, I've met you. You'll be back. But seriously, you are exceptional. And being surrounded by exceptional on a daily basis can certainly skew a person's perception of who does and does not want to hear about the threats to validity in the study you just read. So to our family and friends outside of our programs, I apologize on behalf of all of us. Thank you for tolerating us as we geeked out about the things we are passionate about. The following year was intense. I'm grateful for the opportunity to work with undergraduate and AE students as a teaching assistant and to work under a brilliant mentor as a research assistant. Both gave me valuable skills toward my career goals. Others among us were studying for boards and some were still recovering from advanced pharm. That was also when the PhD students prepared for our qualifying exam. No pressure, just the biggest test of your life. If you don't pass, you don't continue. Thankfully, we were all well prepared. But midway through spring 2020, the world stopped and we waited. Scary, confused, impatient. COVID now affected everything we did and how we did it. The faculty had to pivot to online instruction, research had to pivot to no contact protocols, and we had to get creative and resourceful with our clinical experiences. But we are nurses, and we find a way. When the vaccine first hit Austin in December of 2020, it was the School of Nursing and their partners that mobilized. The leadership, the sacrifice, it was overwhelming to witness. Everyone from unlicensed undergrads to tenured professors, many of you stepped up whenever and wherever you could to help, giving time and energy you didn't have. You gave hours and days, just turned into weeks and months. Some of our guests tonight may not realize, but UT Nursing went into the Austin community to vaccinate as well, to reach our most vulnerable, our most hesitant. I remember working alongside students and faculty at churches in East Austin. These folks were overwhelmed. But by reaching out to them, by meeting them where they were, we were able to offer them the care that they may not have otherwise received. As nurses, we often see people at their most vulnerable, and we take this responsibility very seriously. Many of today's graduates step outside of our programs to help our communities in various roles. And to those of you who worked in direct patient care in the last 2 years, we are all grateful. In the last year of our programs, we are focused on final projects, preparing for certifications, or searching for that dream job. For a PhD student, the final year is about dissertation. I'm grateful for my dissertation committee, for their guidance, for their patience. I'm grateful to be able to see some of my dearest friends graduate and go on to do some really impressive things. UT says what starts here changes the world. And from what I know of today's graduates, I have no doubt. Today marks the end of this story, and tomorrow starts the beginning of a new one, full of new challenges and opportunities. One day, I will be part of someone else's story as faculty. We have all given so much of ourselves to be here tonight, and we are all grateful that our families could be with us to celebrate. Thank you for being part of our journey. As I look out onto tonight's graduates, I am so grateful for everything that you give, for your patience, for your students, for your science, for your profession. To my friends and our esteemed faculty, it has been one of the greatest joys of my life to learn with you and from you. I am forever grateful. Some say that nursing is a calling, but I say it's a choice. Thank you, graduates and faculty. Thank you for choosing this work. Congratulations, everybody.
Thank you, Katie. That was wonderful. So at this time, it's what you've all been waiting for. We're going to recognize individually the candidates for graduation. Assisting in the recognition of degree candidates are Dr. Gail Timmerman, our Senior Associate Dean for Academic Programs, and Dr. Alexandra Garcia, our Graduate Advisor and Professor of Nursing, as well as Dr. Ben Nguyen, Associate Dean for Student Affairs, and Dr. Shalonda Horton, Chair for the Family Public Health and Nursing Leadership Division, and Dr. Lee Chin Lin, Clinical Assistant Professor. Dr. Timmerman will now present by name the graduates who've completed their doctoral study in nursing, and then those who have completed their study towards the Master of Science in Nursing. Dr. Alex Garcia will hood the graduate students, assisted by Dr. Ben Nguyen, an Associate Dean. Dr. Lee Chin Lin will also join us on the stage.
Candidates for doctoral degree in nursing, please rise and come forward. We will first have the Doctor of Philosophy of Nursing. Catherine Allen, dissertation, How Pregnant Women at Risk for Food Insecurity Make Decisions About Food and Nutrition. Dr. Kavita Radhakrishnan, Chair. Leanna Rita Gill, an exploration of symptom clusters, symptoms, and blood-based biomarkers in people with cystic fibrosis during acute pulmonary exacerbation. Dr. Julie Zuniga, Chair. Adem Jengiz, the relationship among CUSIN competencies, the nursing practice environment, and role ambiguity in perioperative nurses. Dr. Linda Yoder, Chair. Enju Choi, the use of social media to explore the unmet needs and supports of adolescents and young adults with cancer. Dr. Heather Becker, Chair. Ashwini Rao Hoskote, understanding school nurses' practice behaviors in adolescent mental health. Dr. Karen Johnson, Chair. Catherine Carroll Britt, mild cognitive impairment and dementia, the impact of religious and spiritual activity on risk, behavioral disturbances, and cognition. Dr. Kavita Radhakrishnan, Chair. Emily Ann Croce, closing the loop, racial and ethnic disparities in access to childhood atopic dermatitis healthcare. Dr. Lynn Rue, Chair. Lisa Ann Davis, Stroke and Time, a discourse analysis of how patients, clinicians, and scientists use talk as social action in the context of acute ischemic stroke. Dr. Jane Champion, Chair. And now we have the Doctor of Nursing Practice candidates. Batia Alamouche. Project, text messaging and phone calls for diabetes education, type diabetes, Jane Champion, scholarly advisor. Melissa Baldwin, measuring the impacts of the addition of resilience training for nurse residents. Dr. Jane Champion, scholarly advisor. Guillermo Ehusebo Carnegie Jr., psychotherapy and opioid management. Dr. Jane Champion, scholarly advisor. Cassidy Chavez, evaluating the effectiveness of a low-carb carbohydrate intervention for the management of glycemic control and type 2 diabetes through retrospective chart review. Dr. Jane Champion, Scholarly Advisor. Faria Chavez Garza, cervical cancer screening in older women. Dr. Jane Champion, Scholarly Advisor. Carly Edgar, a judgment-free zone, experiences with APRN student simulation. Drs. Kara Young and Dr. Heather Cuevas, Scholarly Advisors. Paige Delia Harmony Frock, Exploring Health Literacy, Acculturation and Conversations about Sexual Health in Hispanic, Latinx Mothers of Adolescence. Carrie Young, Scholarly Advisor. Kimberly Lorraine Hale, Ethical Decision-Making Among Nurses in the Context of COVID-19 Vaccine Allocation. Dr. Jane Champion, Scholarly Advisor. Rebecca Hernandez, Exploring Clinical Preparedness Through the Perspective of Family Nurse Practitioner Preceptors. Dr. Janice Hernandez, Scholarly Advisor. April Alonso Herrera, Taking a Pulse on Emotional Intelligence. Dr. Sharon Carter and Danica Fulbright Sumter, Scholarly Advisors. Amy Beth Lynn, An Evaluation of Anemia Screening Policies Affecting Female Air Force Recruits. Dr. Stephanie Morgan, Scholarly Advisor. Teresa Lyons, The Impact of Social Distancing Efforts During COVID-19 Pandemic on Persons Residing in Long-Term Care. Dr. Jane Champion, Scholarly Advisor. Henry Martinez, Comparison of Superficial Surgical Site Infection and Revision Arthroplasty Rates Among Non-Obese, Obese, and Morbidly Obese Cohorts After Total Knee Arthroplasty. Dr. Jane Champion, Scholarly Advisor. Abel Mendez, Nurse Practitioner Attitudes and Perceptions of COVID-19 Treatment. Dr. Jane Champion, Scholarly Advisor. Lisa Morris, Answering the Call, an exploration of the experiences of case investigators and contact tracers who worked during the COVID-19 pandemic. Dr. Jane Champion, Scholarly Advisor. Stacy Janelle Palmer, an evaluation of nutrition education and baccalaureate nursing programs across the country. Dr. Jane Champion, Scholarly Advisor. Sally Stroud, the experiences of case managers planning hospital transitions during COVID-19. Dr. Jane Champion, Scholarly Advisor. Anita Tapa, characteristics of patients and providers associated with antibiotic prescription in treatment of acute sinusitis. Dr. Jane Champion, Scholarly Advisor. Jennifer Suzanne Wade, professional identity and nursing characteristics in managed care nurses. Dr. Jane Champion, Scholarly Advisor. April Watkins, creating an advanced practice registered nurse-led atrial fibrillation clinic, implementation and patient characteristics. Dr. Jane Champion, scholarly advisor. Cheryl Williams, an evaluation of pregnancy outcomes for women enrolled in a nurse home visitation program receiving in-person, telehealth, or hybrid services. Dr. Jane Champion, scholarly advisor. Will the candidates for the Master of Science in Nursing please rise and come forward? Christina Stolte. Grace Manji Kambumba. Christy Hai June. Kylie June Faircloth. Kaylin Greason. Cynthia Lewis. Nicole Janae Manley. Michael Gandara. Mary Salmon. Cynthia Williams. Evilla Yedatore. Angela Zastro Spears. Saida Kadir. Megan Wheeler. Maggie Barron. Abigail May Ross. Rebecca Warner Hindman. Josiane Natalie Henry. Samuel Frazier. Mary Lou Sanchez. Belinda Marie Reed. Megan Messick. Bianca Schmidt. Stephanie Quintero. Vin Do Kwong. Camille Marie Kilbasa. Sarah Jean Colbreth. Isabel Yapobi. Melissa Ibarra. Cindy Shu. Sarah Yuen. Alexandra Rose. Logan Adams. Alexandra Picula. Kirsten Snyder. Rihanna Johnson. Sarah Jo Matthews. Nicole Marie Merman. Sabine Andrea Berghammer. Danielle Dubelshane. Charles Oscar Burnt. Okay, next we're going to have the Postmaster Certificate students. Jamie Fitzgerald. Jason Morris. Aaron Cloak. Emma Smith. Laura Elaine DeFreitas. Chelsea Jones Gallegos. Elizabeth Washington Phillip. Candace Ship. Congratulations.
Congratulations to each and every graduate of the class of May 2022. Would all our degree candidates now please rise, turn, and recognize your parents, spouses, relatives, and friends, family. I have to tell you, I've been doing this a lot of years, and I don't think we've ever had as enthusiastic of a crowd as we have tonight. Okay, please be seated. We are very proud of the achievements and accomplishments to date of all of our graduates, and we know they will excel with integrity and a spirit that nothing is impossible. They will serve as leaders in nursing in Texas and beyond, and the quality of nursing and healthcare will be enhanced by their leadership, critical thinking, and clinical judgment skills that they will use to serve society by promoting the comfort, dignity, and health of those that they care for in their communities, around the nation, and around the world. I've been asked to convey by the university convey additional information for those of you who are planning to participate in the university-wide commencement ceremony at the DKR Stadium on Saturday evening. Degree candidates participating in the grand procession at the university-wide ceremony will be required to present a ticket as they begin the procession. For the university-wide commencement, the School of Nursing and graduate school graduates will be included in the west side procession. So please plan to arrive in the marshalling area at the DKR TMS loading dock on the west side of the stadium by 6:45. This is graduates. And if you get lost, you can't figure out what you're supposed to do, look at the commencement website. Tickets are required for all guests attending, but guess what? They're free. Who knew that? And there is no limit to the number of guests a graduate may invite, and ticket information and everything else is on the university commencement website. Admission is on a first-come, first-served basis for guests, and the stadium doors will open to guests at 6 p.m. tomorrow, and the ceremony will start promptly at 7:30. Following today's convocation, we ask that guests please remain seated until the platform party and all the guests have cleared the auditorium. So thank you to all of you who have joined us with such support and enthusiasm tonight, and to those of you virtually who couldn't be here. So congratulations to each of our May 2022 graduates and perfect.
It's just fine. I would love a much cushier that I can lean back on. Just some drinks on this one. This is better than that. Thanks for taking it. I just have a tiny box. That's fine.
Please be seated. You'd never know it was Friday night, would you? Welcome to the May 2022 School of Nursing graduation. We are pleased to welcome our very special graduates, friends, and family members, and fan clubs that we'll hear from later, who are joining us in person tonight at the Bass Concert Hall on the UT Austin campus, as well as those of you across the nation and the world who are watching the live stream video. The faculty and other administrators of the University of Texas at Austin are proud today to recognize 147 very special graduates. Earlier this evening, we recognized our graduating PhD, Doctor of Nursing Practice, and Masters of Science in Nursing graduates. In this ceremony, we are proud to recognize 57 students who will receive the Bachelor's of Science in Nursing degree. As part of our ceremony, I would like to recognize first the faculty and the staff of the School of Nursing who have supported our students during this very challenging educational journey, as well as the many clinical and community partners who've provided the essential experiential learning. Our faculty includes experienced, renowned teachers, clinicians, and researchers who strongly believe that the nursing profession is vital to the public good. Throughout their teaching at all levels of our curriculum, the faculty are committed to preparing students to address the many significant healthcare challenges of the 21st century. Faculty, please stand. Thank you. Please be seated. I would also like to give special recognition tonight to two faculty who are retiring after many years of service to the school and the profession of nursing. Dr. Gail Acton, who's been our Assistant Dean for Graduate Programs, and Dr. Sherry Inararity, the Marshal for today's convocation. Thank you to both of them for their leadership and dedication to the educational programs and students at the School of Nursing. I'm confident that most of you, maybe all of you, have heard it said, "What starts here changes the world." Well, I would venture to add that what starts here at the UT Austin School of Nursing heals the world. And that isn't because we prepare our students with all of the specific technical and clinical skills and knowledge they will need in the professional practice of nursing, although we most certainly do. It isn't because we provide them the necessary foundation upon which they can build successful and rewarding careers in clinical settings or in academia, although we do that as well. We say what starts here heals the world because in the great tradition of the University of Texas at Austin, we prepare our students to be continual learners and courageous leaders whose care for individuals and families in our community combines the latest in the art and science of nursing. The core purpose of the University of Texas at Austin is to transform students' lives for the benefit of society. And that has never been more important than in these last 26 months when we face the massive public health crisis of the COVID-19 pandemic. Simply put, nurses have been heroes every day and in every setting. And the need for and value of nurses, especially the well-educated Longhorn nurse leaders graduating today, has never been greater. When today's graduates started their programs of study, no one anticipated the unbelievable challenges our country, our state, our university and our school and our students would face during this global COVID-19 pandemic. While most students at the university spent the 2021 academic year online, our students were coming to classes and labs and clinicals in person. They adjusted to a building with new restrictions and rules. They gave extra time to properly don and doff their full complement of PPE, and they found ways to connect with each other and faculty while socially distanced. As healthcare providers, they were among the first to get vaccinated, and subsequently they provided thousands of hours to vaccinate the public. You all embrace the professional duty to take care of yourselves and others. Your path was most assuredly different than what you planned when you started this program, but the goal was the same, to see all of you graduate today, and congratulations, you did it. In recognition of your accomplishments during this historic time, and make no mistake, you will be remembering this all your lives, all of our graduating BSN students will receive the custom pin of the University of Texas at Austin, engraved with this historic year. Our UT Austin School of Nursing pin, which you have seen inlaid in the terrazzo floor of our new lobby, incorporates the history and the symbols unique to our nursing program. Our pin incorporates the 5-point Texas star that is seen in the seal of the great state of Texas, and it incorporates the shield from the University of Texas at Austin academic seal. Under the University of Texas, if you look closely, you can see the Latin phrase, quo ducat officium, which translates in modern English as wherever duty leads. Wherever duty leads has seemed especially meaningful as we've witnessed the heroic actions of nurses around the world. Nurse clinicians, nurse researchers, nurse leaders, and nurse educators, all making a difference in the health of our population. I feel incredibly privileged to be here today in person among these outstanding graduates and their friends and families who have come to celebrate this hard-earned success. I can promise you that all of these graduates understand the urgency and necessity of striving for excellence in healthcare practice and delivery, education, and research. And these last 2 years have reminded the world of how critical nurses and nursing leadership are to not only the quality of care and well-being of our nation, but our very survival. Each one of you will someday need a nurse, and I hope it's a Texas nurse, a Longhorn nurse. When you need nursing care, you should know that there's a very strong body of evidence supporting that the education of your nurse and the quality of the very care you receive is linked to a variety of positive health outcomes. Everything from decreasing hospital readmission rates, decreased infections, and lower mortality rates. So in fact, your very survival is linked to the quality and education of your nurses. We believe that excellence in supporting and promoting health in our population is about providing every person the means and opportunity to live the healthiest life they possibly can, so that the opportunity to achieve health is not a matter of chance related to your place of birth or your ethnicity or your income or other personal factors. And this broad vision for health cannot be accomplished without nurses. And as I suspect many of you in the audience know, nurses make up the largest group of healthcare professionals in the United States, more than 4.3 million nurses, and year after year are identified as the most trusted profession by the American public. And by the way, the estimates are that worldwide nurses provide 75% of all healthcare. So this is an international phenomenon. As we look at the challenges facing us today, the need for healthcare redesign that focuses on value-based care and addresses social determinants of health and patient and provider satisfaction, it is absolutely essential that nurses are part of the team leading those efforts. Nurses as a group are strong-willed. And believe me, as a dean, I've gotten to know just how strong-willed they can be. And they're passionate about their work, and they care deeply about those in their care, regardless if it's the intensive care unit or a healthcare system. So yes, change is difficult, but nurses know how to get difficult things done, because that is what nurses do every single day of their professional life. If we are to make a difference and change the world, then it's imperative that we, and graduates, I'm looking at you, better communicate a vision and have the courage to change how healthcare is provided in a more equitable fashion. And we must acknowledge the incredible hard work and dedication that's necessary to seeing that vision through. And I know that after getting through this program successfully, you all know about hard work, right? So my questions to all of you graduating today: are you determined to see that these changes happened, to in fact change the world? And perhaps more importantly, what role will you take in making these changes happen? We will now have congratulatory remarks from a representative of our graduating undergraduate students. Christopher, better known as CJ Lagon. CJ will now speak on behalf of the graduating students.
Let him have it, CJ! Take your time.
Good evening. Oh, come on. I thought you were excited about graduation. Good evening. That's better. Good evening, classmates, colleagues, professors, and family. My name is CJ Lagon, and I want to thank everyone for joining us on this pivotal and long-awaited day of graduation. Now, after completing an average of 107 exams, 254 quizzes, 695 individual assignments, 516 clinical hours, 46 hours of pre- and post-conference, we have made it. And yes, I actually calculated those numbers, believe it or not. The past 4 years of our journey through nursing school has been arduous and challenging. But despite these setbacks, we became more resilient than ever. During our freshman year, we survived a flood that caused the water system in our dorms to be shut down for several days. Towards the end of our sophomore year, the world was devastated by COVID-19, and we had to leave campus prematurely. This led us to develop, new skills and strategies to combat the new Zoom learning environment, of course. We completed our head-to-toe assessments on our siblings, cousins, and other very diffused family members. At the start of our junior year, we were in person while the majority of the university was virtual. Amidst this isolated time away from family and friends, we were still battling the unknown of COVID-19. And to make matters more complicated, we had to start clinical rotations at the hospital. Just after getting routine clinicals and becoming acclimated to a new learning environment, we were hit with the snowpocalypse of 2021. Many of us ran out of food, lost electricity, housed fellow classmates, had pipes burst, and were still required to turn in assignments and take exams. What doesn't kill us makes you stronger, right? Now, during this semester, we were also taking maternity and completing our labor and delivery rotation. Now, for the 7 males in our graduating class, labor and delivery was a very interesting but very valuable learning experience. Before this class, I had no idea what happened during childbirth, how long it would take, nor the challenges that moms have to go through. So shout out to my mom, thank you. I appreciate what you had to go through, really took over the team. And also shout out to other moms out there as well. Now, many of my classmates know that I love to pump some iron. You probably can't tell because of the gown, of course, but these arms, they are carved. And I mean absolutely chiseled. Now, pumping iron is good for the muscles, but sharpening iron is better. What I mean by this is that as iron sharpens iron, one student sharpens the other, and indeed, we have sharpened one another. Without struggle, pressure, and hard work, there is no meaningful progress. Our class has published one research project, has one President's Award for Global Learning winner and 2 finalists, has one UT Outstanding Student Award finalist, has 3 Terry Scholars, revitalized a dormant student organization, filled dozens of clinical intern and externship positions, tutored and mentored the younger cohorts, given hundreds of COVID vaccinations, have a commissioned Army ROTC graduate. I'm not done. And we have secured job positions in the Austin, Dallas, Fort Worth, San Antonio, Colorado, and of course, Houston areas. Today, there will be 21 white Americans, 17 Latinx Americans, 12 Asian Americans, 4 African Americans, and 3 multiracial Americans graduating in the class of 57. Out of this 57, 50 are female and 7 are male. And today, I will be the only African American male to graduate in my class. When I started here 4 years ago in August of 2018, we did not have a dedicated program for diversity. Today, we have an associate dean for diversity, equity, and inclusion, and are moving in the right direction. I don't share this data with you to make you feel bad or sorrowful. I share this data with everyone as a reminder of the progress that we have made and the work that we must continue to do. We may have come to this country on different ships, but we are all in the same boat now. Diversity matters not only for quality learning in classrooms, but also quality care in hospitals. During my junior year of clinical rotations, I gave care to an African American woman who was admitted for uncontrolled high blood sugar. I explained to her what her current health status was, taught her about hyperglycemia, and gave her some insulin to decrease her blood sugar. After that, I asked her, "Is there anything else that I can do for you, ma'am?" She then asked me what's next for managing the high blood sugar and resources that she can use. I was able to get the diabetes nurse educator to assist her by answering her questions and concerns. Before I left for the day, I thanked her for allowing me to provide care for her. She then explained that no one had come to discuss her plan of care and that she had felt forgotten. Before I left the room, she told me, "You are the only person in this hospital that is giving me care. And I want to thank you for what you are doing." Many of us have had patients who didn't speak English and were a crucial facilitator of their care by translating. Being a healthcare provider that comes from the same or similar culture of the patient allows us to have a deeper connection to them. This in turn will drive better patient outcomes by allowing them to have a safe space to disclose their health problems, seek more preventative care options, and shields them from the implicit biases that are embedded within our healthcare system. We must build healthcare and healthcare education entities that are continuing to push diversity from all walks of life. The more we expand the collective thoughts of students and faculty, the more holistic viewpoints we acquire. Thus, the better we are able to deliver high-quality, patient-centered care. As we embark on the next segment of our lives to become nurses, we will face many unknown and obscure situations in the hospital. But with the skills, knowledge, and experiences gained, we have been forged to shape the future of nursing education and healthcare. With persistence and dogged determination, we can create significant and positive change in this world. As I conclude, I want to share another story of a patient that I took care of. I won't give a full SBAR report or nursing report, of course, but he was a 68-year-old man battling metastatic stage 4 lung cancer. I observed the nurse and the doctor turning off the pumps and reducing the ventilator settings. As I watched him pass, his blood pressure started fluctuating. His heart rate began to elevate significantly, and his chest began to rise and sink slowly. I held his hand as he was passing away. This was my first patient to pass. I share this story because it is a reminder that our time here on earth is truly limited. With diversity, everyone in this room has been given wonderful and amazing talents that cannot be measured by a standardized exam or evaluation. So I ask us, if tomorrow were not promised, what would you do with your talents and gifts today? I encourage us all to keep pushing the boundaries and barriers of what we have been told and taught. It is only through rigorous testing and experimenting by which we shape the future. And even if we miss the moon as our target, we will still land amongst the stars. From the late nights, early clinical mornings, countless exams, and truly uncontrollable situations, we have been battle tested. And I can confidently say that the class of 2022 has accomplished all 4 of these things. We came, we saw, we conquered, but most importantly, we endured. Thank you very much for letting me speak today.
I have to find the right page. There we go. So at this time, the moment you've been waiting for, we will recognize individually the candidates for graduation. Assisting in the recognition of degree candidates is Dr. Ona Todd, Assistant Dean for Undergraduate Programs, Dr. Lee Goldstein, a Clinical Assistant Professor and Director of the Learning Enhancement and Academic Progress LEAP Center, Dr. Nicole Murray, Dr. Ben Nguyen, our Associate Dean for Student Affairs, and Dr. Shalonda Horton, Chair for the Family and Public Health and Nursing Leadership Division, and Dr. Lee Chin Lin. Dr. Todd will now present by name the graduates who have completed their Bachelor's of Science in Nursing. Dr. Lee Goldstein and Dr. Nicole Murray will pin the undergraduate students, and Associate Dean Ben Nguyen will keep the traffic moving here on stage. So, Anna, take it away.
Okay. Okay, would the candidates for the Bachelor of Science please stand and come forward? Christopher C.J. Ligon. Crystal Ogechi Adelaide. Christine Kalechi Adelaide. Janira Jacqueline Cruz. Jessica Marie Pangang Rosario. Tiffany Pham. Brandon Barry Nalen. Taylor Brooke Herrera. Sophia Karen Torres. Norma Leticia Perales. Seth Duran. Timothy Chris. Meredith Jane Rauch. Rupa Desai. Isha Patel. Sunny Kang. Ann Min Lee. Adriana Elise Martinez. Cindy Yu Sum Lin. Janet Elo Saribu. Hannah Louise Tyndall. Natalie Farrington. Reshma Rose Kareem. Tay Kim. Brianna Johnson. Elena Lovitt. Nisa Gomez Fadi. Lauren Garcia. Fidelia Joy Reynolds. Brooke Eve Renee. Cassandra Natalie Salis. Lauren Beckridge. Jennifer Vasky. Caroline Ann Burton. Callie Frances Pate. Freya Louise Merendorf. Allison Renee Pemberton. Mary Claire Sides. Bailey Ashton Reagan. Margaret Allison Cartwright. Kristen Nicole Yoder. Jacob Robert Lawrence. Michelle Hung Nguyen. Isabella Grace Elhaj. Hannah Jian Lee. Paige Elizabeth Lindsay. Rose Elizabeth Dopkin. Aurora Maria Colon. Emma Grace Clark. Carly Ann Skupka. Aubrey Lynn Moore. Emily Marguerite Slaughter. Jenna Elise Nicholas. Jamie Ann Medina. Gerardo Salazar. Kayla Janae Moore. Kendall Nicole Reese. That concludes BSN graduates.
I'm waiting for them all to get back. Got a couple more pictures. Maybe. Okay. Congratulations to each and every graduate of the class of May 2022. Now, would all our degree candidates please rise, turn, and recognize your parents, spouses, relatives, and friends. Okay, thank you. Okay, graduates, you can be seated. That's a pretty excited fan club you got there. I'm impressed. Graduates, we are very proud of the achievements and accomplishments to date for all of you. We know that our graduates will excel with integrity and the spirit that nothing is impossible. They will serve as leaders in nursing in Texas and beyond, and the quality of nursing and healthcare will be enhanced by their leadership, their critical thinking, and their clinical judgment skills that they will use to serve society by promoting the comfort, dignity, and health of those they care for in their communities, around the nation, and around the world. Congratulations to each of you, and especially to your family and friends who now have their very own nurse to turn to. Graduates and friends, I've been asked by the university to convey some additional information for those of you who are planning to participate in the university-wide commencement ceremony at DKR tomorrow evening. And I hope you'll all be there, and I hope you'll be very noisy when I introduce you as the graduating class of nurses. And your family too. We are small, but we are mighty. So degree candidates who are participating in the grand procession at the university-wide ceremony will have to present the ticket. But guess what? You don't have to pay for the ticket. Isn't that great? You already paid for it, I think. But for the university-wide commencement, the School of Nursing graduates will enter from the west side. They will be in the west side procession. So you should plan to arrive in the marshalling area at the DKR TMS loading dock, which is on the west side of the stadium, by 6:45 p.m. to line up for the procession. Tickets are also required for all guests that are attending the university-wide ceremony. Again, there's no limit to the number of guests, and I think they're free. So, but you do need to get a ticket. You can get this online through the university commencement website. And all kinds of other information is there about the safety things, and if, you know, we could have some weather. So watch that website. And guests, admission is on a first come, first served basis. Stadium doors open to guests at 6:00 p.m. and the ceremony starts promptly at 7:30 p.m. Following today's convocation, we ask that guests please remain seated until the platform party and all the graduates have cleared the auditorium. Thank you to all of you who have joined us in person tonight and virtually. And congratulations to each of the May 2022 graduates, and welcome.